seeing on the X-ray to be able to detect any abnormality. But first we have to know, of course, that in the lungs, in the tissue of the lungs, we have, of course, interstitial tissue, which are the tissue of the lungs itself, the bronchi, as we all know, the bronchi which let the air enter to the lungs, the bronchioles, which are the small bronchi, and last, the alveoli, where the oxygen and CO2 will exchange. And so this is the main thing, of course, the alveoli. And around the alveoli, of course, we will have vessels, and in the lungs, we also will have vessels. So usually the alveoli space, because it's only air, we will see it transparent in the lung. And we will see it, of course, on the X-ray as transparent. We will not see the alveoli itself. Like I said before, we will only see signs to detect what we have wrong.
Okay.
Okay. Do you want to translate or it's fine?
Yes, a little bit. អញ្ចឹងមិញ slide មុនមិញគាត់និយាយប្រាប់គ្នាយើងអំពីសួតហើយនេះគឺជាការសិក្សាមួយដែលគេពាក់ព័ន្ធជាមួយនឹង cytology នៅលើសួតអញ្ចឹងគ្នាយើងត្រូវស្គាល់ថាស្អីគេ bronchi ហើយមួយទៀតគឺពាក់ព័ន្ធជាមួយនឹង alveole ហើយនឹងប្រព័ន្ធសរសៃឈាមអញ្ចឹងដូចជារូបភាពដែលគាត់បានបង្ហាញនេះគឺត្រូវបានគេធ្វើជា cytology ដើម្បីឲ្យងាយយើងឲ្យគ្នាយើងងាយស្រួលនៅក្នុងការមើលទៅលើកោសិការបស់សួតនឹងអញ្ចឹងដំណាក់កាលដំបូងគឺគ្នាយើងត្រូវស្គាល់ anatomy សិនមុននឹងយើងអាចងាយស្រួលនៅក្នុងការមើលX-ray គេហៅថា imaging diagnosing ហ្នឹង Okay, you can continue.
Okay. So now we will talk about the opacity that I was talking about, the sign that we have to see to know what's the problem. We have to do a description of the picture we are seeing first. How do we describe it? We have to use, of course, medical words to describe it in order after that to know what's the abnormality. So we have 5 things that we should know. This is very important because when you talk about an X-ray of the thorax, you have to say we have interstitial pattern or nodular pattern or bronchial pattern or alveolar pattern or vascular pattern. So when I describe an X-ray, for example, I'm gonna say I'm seeing a bronchial pattern or bronchial opacity. This will lead us to the main problem in order to treat, of course. But before going to the main problem, we have to describe. And this is what I'm going to talk about today. How do we see interstitial pattern? How do we know it's a nodular pattern? What are the causes of bronchial pattern? We will talk about it today. So these 5 words are very important. Also, we should know, like in complex cases, we can have multiple pattern opacity that we're gonna be a little bit mixed up with them. But this is in very specific diseases, so not in all diseases. And now we're gonna focus more about the basics, not very complex cases. All right. I'm gonna translation.
Yeah, a little bit. Just in summary. So អញ្ចឹងទាំងអស់គ្នាអញ្ចឹងគាត់នឹងធ្វើការបង្ហាញគ្នាយើងពាក់ព័ន្ធជាមួយនឹងពាក្យទាំង5ហ្នឹងអញ្ចឹងពាក្យទាំង5ហ្នឹងគឺជា term មួយសម្រាប់បង្ហាញពី case ដែលកើតឡើងអញ្ចឹងគ្នាយើងព្យាយាមស្គាល់របស់វាទាំងអស់ហើយអញ្ចឹងបន្តមកទៀតគាត់អត់បង្ហាញជាលក្ខណៈស៊ីជម្រៅទេគាត់នឹងបង្ហាញគ្នាយើងជា basic នៅសម្រាប់ពាក្យទាំង5ហ្នឹងអញ្ចឹងគ្នាយើងនឹងឃើញថានឹង case ជាក់ស្ដែងអ្វីដែលនឹងមានហើយទាំងអស់គ្នាព្យាយាមតាមឲ្យតាន់មែនទែនសម្រាប់ពាក្យទាំង5ហ្នឹងណា អញ្ចឹងបន្ទាប់ពីចប់នឹងហើយខ្ញុំនឹងបញ្ចូលគ្នាយើងបន្តទៀតតើពាក្យទាំង5នឹងមានន័យថាម៉េចខ្លះ Okay, you can continue.
Okay.
Thank you.
Also, like I said, we will describe the picture. We will say what's the pattern. Also, we will say where is it? Is it diffused, like everywhere, in all of the lung? Is it in one place, focal, in one of the lobes of the lung? Or is it multifocal, like in 2 lobe or 3 lobes, but not diffused, of course? And focal and multifocal, we have to say where it's localized. Is it the caudal lobe? Is it the dorsal lobe? We will talk about the distribution later, but we have to describe where is it. Because with some cases, of course, not all the lobes are affected, only certain lobes are affected. So we have to say, let's give an example, the mid-lobe. The mid-lobe in cat, if it's affected, we know it's the cat is probably asthmatic. So it's very important to say where is the problem, where is the lesion we're seeing. And that's why it's very important to talk also about the anatomy, which I'll be talking about later. And the next slide.
Okay.
Okay.
អញ្ចឹងគាត់នឹងបង្ហាញគ្នាយើងពី case ហើយអ្វីដែលគ្នាយើងដែលពិបាកជាងគេនោះគឺពាក់ព័ន្ធជាមួយនឹង anatomy អញ្ចឹង anatomy វាជារឿងសំខាន់សម្រាប់គ្នាយើងអញ្ចឹងគ្នាយើងធ្លាប់ជួបខ្ញុំតែងតែនិយាយរឿង anatomy ហ្នឹងអញ្ចឹងនៅក្នុងនេះគាត់នឹងបង្ហាញអំពីករណីខ្លែបសួតមានបញ្ហានៅលើខ្លែបសួតហើយអញ្ចឹងទាំងអស់គ្នាត្រូវតែព្យាយាមស្វែងយល់ថាតើសួតមានប្រមាណខ្លែបហើយខ្លែបមួយណាដែលងាយនឹងរងនៅបញ្ហាជាងគេអញ្ចឹងនៅក្នុងនេះគាត់នឹងបង្ហាញករណីពីរដែលកើតឡើង Okay, you can continue.
Okay. So I want to ask if anyone has a question that would like to ask before I continue.
មានគេមានសំណួរអីអាចសួរបានមកសម្បូរមានសំណួរអីសម្បូរ
Don't have.
Don't have? Okay, Sambo.
Yeah.
ពីណាគេមានសំណួរអីកណ្ឌិកាDo you have any question
ចាលោកគ្រូ
មានសំណួរអីអាចសួរបាន
អត់ទេលោកគ្រូ
So they don't have now I think next time next slide I hope Okay yeah
So now we talk about the anatomy. You should all know the anatomy, of course. I'm gonna just remind you of the anatomy. And like we say, it's very important when we do a description. First, we will say what pattern is it. Then we have to say where is it. And we have to know the anatomy to know where is it exactly. Okay, we have, of course, 2 lungs. Like the lungs is cut in 2. We have the right one and the left one. You can see it all there. This is a front view, that's what we call it. So when the animal, a cat or a dog, is lying on the back or on the thorax, this is what we will have. And this is, the other one is the side view. We can have left or right, of course. The animal is in lateral position, and we can see the left side or the right side. So that's very important to know what's the position the animal is laying in. On the back, which side is the right, which side is the left. When we look at the lung, we know it's not symmetrical. It doesn't look, this side doesn't look like the same as this side. And we have the right side, which is 25 bigger than the left one, of course. If we want to talk about location, let's say the lesion is here. We will say it's the median right lobe because it's on the right place and it's in the middle. It's this lobe. Let's say it's this lobe that it's affected. It's the cranial right lobe. So it's cranial. This part is cranial. This is the head. This is caudal, where we have the abdomen. We will say it's, let's say it's here. We will say the right side caudal part have the problem. And same for the left one. So if it's here, we will say caudal left part, medial caudal part, medial left part, and here left caudal part have the problem. Same as if we're talking about the side view. Let's say the animal is lying in a lateral position. We will say it's left side. Let's say left side here. We will say it's either the cranial lobe, the medial lobe, or the caudal lobe, which have the problem. So this goes also in the description, and the location, of course, is very important to know what's the problem. All right. Translate.
គ្នាយើងអញ្ចឹងនេះគឺជាទម្រង់នៃសួតហើយសួតត្រូវបានគេបែងចែកជា6 clap សួតហើយមួយទៀតអ្វីដែលគ្នាយើងត្រូវដឹងគឺអំពី position របស់វាអញ្ចឹងគ្នាយើងបានស្គាល់ position ហ្នឹងណា cranial caudal ventral dorsal អីគ្នាយើងស្គាល់ហើយបានដឹងអស់ហើយអញ្ចឹងមួយទៀតសួតផ្នែកខាងស្ដាំគឺវាមានទំហំធំជាង 20% នៃសួតផ្នែកខាងឆ្វេងតោះ Okay, you can continue.
Okay, so we go to the next slide. In practice, what we will say, we can say, like I said already, but more into details. Let's go more into details to describe where is the lesion. So as you can see here, this is the thorax. It's lateral. It's a side view, not a front view. The animal is laying lateral. Let's say we have the lesion here, okay? What do we call it? It's gonna be cranial because the head is here. Ventral because ventrally. So this is the ventral part. So the lesion is cranioventrally. Here. This is all here. The red one is very important too because this is called perielar location, which is also very important because some diseases will show only on this part on the x-ray. Like if we have edema in the dog, so like fluid from heart problem, we will see it in this area. Not in this, not in this, not in this, it's gonna be here. Sorry. So this is called the perielar area. Then we go here, the blue area, as we see it's dorsal. This is the dorsal part of the animal. Caudal, the abdomen is here. So this is the caudodorsal area. And the last area we'll talk about is the caudoventral area. So this place here. So when we describe a lesion, it's gonna be, I repeat, we have to say, where is it? Because it's not gonna be in all of the lungs. Sometimes it's gonna be in 1 or 2 parts of the lungs, and we should know that. In order to know the abnormality, it's very important to say where is it? Where is the lesion? The location of the lesion. And we have to know this by heart. Because if I ask you to describe an x-ray and you will say just one word, it's gonna be all wrong. It's not one word, like this animal have infection. you have to say, have pattern here, location, and then say, can have an infection. Yeah, that's it.
អញ្ចឹងនៅក្នុងនេះគឺពាក់ព័ន្ធជាមួយនឹងការអនុវត្តតែម្ដងអញ្ចឹងអ្វីដែលគ្នាយើងសំខាន់គឺស្គាល់អំពីទីតាំងរបស់វាអញ្ចឹងដូចខ្ញុំបានប្រាប់មុនហ្នឹងអញ្ចឹងវាមាន caudal អញ្ចឹងមាន caudal មាន dorsal ventral អញ្ចឹងគ្នាយើងត្រូវស្គាល់ទាំងអស់ដូចក្នុងករណីនេះដោយរូបពណ៌លឿងនេះមានន័យថាផ្នែកខាងមុខអញ្ចឹងផ្នែកខាងមុខនេះគឺយើងឲ្យឈ្មោះវាថាជា ventral អញ្ចឹងអ្វីដែលធ្វើការបកប្រែនៅក្នុង X-ray គឺប្រាប់អំពីទីតាំងហើយនឹងបញ្ហានៃការរលាកដូចឧទាហរណ៍ថាពាក់ព័ន្ធជាមួយនឹងផ្នែកខាងក្រហមនេះអញ្ចឹងជាទូទៅបើសិនតែករណីដែលសត្វមានបញ្ហាបេះដូងហើយមានបញ្ហា edema ស្គាល់ edema អញ្ចឹង edema ហ្នឹងមានន័យថាមានបញ្ហា fluid នៅខាងក្នុងសារពាង្គកាយរបស់សត្វដោយសារតែសត្វមានបញ្ហាបេះដូងអញ្ចឹងវាសម្របសម្រួលសារធាតុទឹកអត់បានល្អអញ្ចឹងនៅពេលដែលវាមានបញ្ហាគឺវាមាននៅក្នុងផ្នែកខាងក្រហមនេះអញ្ចឹងគេឲ្យឈ្មោះថា perhila នៅផ្នែកខាងនេះហើយនេះគឺផ្នែកខាងក្រោយនេះគេឲ្យឈ្មោះថាជា caudal សំទោសគេហៅថាជា dorsal caudal នេះហើយផ្នែកខាងក្រោមនេះគឺគេឲ្យឈ្មោះថាគឺជា ventral នេះផ្នែកខាងនេះអញ្ចឹងទាំងអស់គ្នាត្រូវចាំ position នឹងទាំងអស់ដើម្បីងាយស្រួលនៅក្នុងការបកប្រែទៅលើ X-ray ណាតោះនេះតាក្នុងចំណុចនឹងមានសំណួរអីមានអីឆ្ងល់ទេ
លោកគ្រូខ្ញុំអត់ទាន់ច្បាស់លោកគ្រូអាចបញ្យល់ម្ដងទៀតបានទេព្រោះអីលោកគ្រូពេលខ្លះបើសិនជាមានបញ្ហាឧទាហរណ៍ថាសាច់ហ្នឹងវាមុតឬក៏វាត្រូវរបួសចាំងចុងដៃចូលទៅខាងក្នុងអាកន្លែង perihila ហ្នឹងអាហ្នឹងអាពេលយើងពិនិត្យមើលទៅប៉ុន្តែលោកគ្រូបើសិនជាវាចាក់ចូលទៅដល់កន្លែងស៊ូតអីទៀតអាហ្នឹងវាមានបញ្ហាអីទៀតទេលោកគ្រូ
Okay. So hello Dr. Saida, the student have a question.
Yes.
So she would like to know about for example, the location perihila. If
Yes.
Have any puncture.
Puncture?
Yeah, puncture in this side. It a problem with the animal or no?
What do you mean by puncture?
So for example, some narrow puncture.
Yeah. Okay. We will talk about this later. We will go through lesion in this place.
Okay.
Don't worry. We will talk about this later. For now, I want you to know how to localize. If we see something here, we have to say it's perihilar.
Okay.
But we will talk later about what we see here, what can it be. We will talk about, don't worry.
Okay. អញ្ចឹងមិញមកគាត់នឹងបញ្យល់គ្នាយើងនៅពេលក្រោយអ្វីដែលក្នុងចំណុចនេះគឺចង់ឲ្យគ្នាយើងដឹងអំពី location មានន័យថាទីតាំងតើកន្លែងណាគេហៅអីហើយវាមានឈ្មោះថាម៉េចអញ្ចឹងសម្រាប់ការសិក្សាទៅលើ diagnosis imaging គឺមានសារៈសំខាន់ណាស់គឺពាក់ព័ន្ធជាមួយនឹង location បើគ្នាយើងអត់ស្គាល់ពី location ច្បាស់អត់ស្គាល់ពី anatomy ច្បាស់អាហ្នឹងយើងពិបាកនៅក្នុងការយល់អញ្ចឹងតិចទៀតគាត់នឹងបង្ហាញតោះនេះយើងអ្នកកណ្ដាលមិញអ្នកសួរមិញ
ចាលោកគ្រូ
Okay, we can continue.
Okay.
Yeah.
So this is just a repetition, like a summary of what I talked about. So we have to say about the opacity. What is it? This one we have to identify. I will talk about this one later. This one, what I will be talking about a lot now. We have to say, is it the opacity, what we see in front of us, that is not normal? What is it? Affecting like interstitial, nodular, bronchial, alveolar, nodular. Sorry, I repeat this one 2 times. Supposed to be vascular here. So what's the opacity that we're seeing that is not normal, we have to say localization. Is it diffuse? All the lungs are affected, focal and one point, multifocal and different point. And of course, we have to say the distribution. Where is it exactly, which I just talked about. So this is just a summary of everything I talked about. Just this one is vascular. I will change it before I send the PowerPoint. Okay, so this is just a summary, what I've talked about since I started. The opacity, localization, and distribution. This is just for description, because also, I repeat, we have to describe before we know what's the problem. Because based on the description, we can know the problem that we have. Okay? Do you need to translate?
Just summarize for them a little bit. អញ្ចឹងគ្នាយើងអញ្ចឹងគាត់នឹងធ្វើការបង្ហាញគ្នាយើងពាក់ព័ន្ធជាមួយនឹងពាក់ព័ន្ធជាមួយនឹង opacification ហើយនឹង localize ហើយនឹង distribution អញ្ចឹងសង្ខេបមកគាត់និយាយទាំងអស់មកមិញហ្នឹងគឺចំណុច3ធំហ្នឹងហើយគាត់នឹងបង្ហាញមួយថាតើនៅកន្លែងមួយដែលមានបញ្ហាហ្នឹងយើងមើលទៅឃើញរបៀបម៉េចហើយយើងគួរតែបកប្រែឬក៏យើងគួរតែអានលទ្ធផលដែលបានមកពី X-ray ហ្នឹងបែបណាអញ្ចឹងលទ្ធផលដែលចេញមកឃើញតែសខ្មៅពេលខ្លះយើងអត់ដឹងថាវានឹងមានបញ្ហាអីហើយបើសិនតែយើងអត់ធ្លាប់ជួបករណី case ហ្នឹងក៏យើងមិនដឹងថាបកប្រែរបៀបម៉េចដែរ Okay, you can continue.
Okay. So we're going to talk first about normal lungs. What do we see in the lungs usually? Okay. Can I have people tell me what do they see in the lungs usually? What is this? All of this. What is it?
អញ្ចឹងមានពីណាគេអាចនិយាយបានប្រាប់គាត់ទេថាតើរូបដែលឃើញហ្នឹងមានន័យថាម៉េចឃើញអីគេខ្លះឃើញឥឡូវអាច
ឃើញពងខ្យល់បេះដូងហើយទាំងនឹងតម្រងសួត
សុំជួយនិយាយជាពាក្យ terminology តិចណាសម្បូរមកសម្បូរជួយនិយាយជា term មកទីមក
អត់ជាពាក្យ terminology លោកគ្រូខ្ញុំ click បាត់ហើយពាក្យហ្នឹងលោកគ្រូ
ចាំមើល
លោកគ្រូសូមជួយ translate ឲ្យគាត់
So they saw some lung bronchi and okay. Now I will appoint the student, one more student to see. មើលសិលាមកហើយសិលា
ចាលោកគ្រូ
មកឃើញអីគេខ្លះនៅក្នុងរូបហ្នឹង
លោកគ្រូនិយាយខ្មែរដែរខ្ញុំអត់ដឹងពាក្យនេះដែរ
terminology
ទីមួយខ្ញុំឃើញកំពង់ខ្យល់បន្ទាប់មកទៀតសួតហើយនឹងទម្រង់បេះដូងលោកគ្រូទីនឹង
អីទៀត
លោកគ្រូខ្ញុំមានតែប៉ុណ្្នឹងទេលោកគ្រូ
អាចជួយនិយាយជាភាសាបរទេសឲ្យបន្តិចមកសិលា
លោកគ្រូអី
Okay.
First, says the lung pressures, and then says heart. Yes. That is say in the picture.
Yes. Okay, but we will go more into details. because you will be
Okay.
surprised at something. So
Excuse
of course, everyone knows.
hello, excuse me.
Yes.
So I would like to told you that the Zoom will cut out in 1 minute. So I think I will send you a new link, and then we will start again with this point, this slide. Okay. Okay, because I don't want to we just have explain and then cut out. I'm sorry with this.
Okay, no. Yes, no problem.
Okay. តើទាំងអស់គ្នាចាំចូលទៅក្នុង wiki លឿនតិចណាព្រោះដោយសារតែ Zoom ដាច់ណានៅពេលដែល Zoom ដាច់